What's the underlying cause of obesity and Alzheimer's? A disrupted metabolism. Obesity is easy. You say, "Whoa, something's wrong. I'm looking at the mirror." But the brain, it's more subtle. But the mechanisms are exactly the same, and therefore I believe the treatment and prevention is exactly the same.
Hello, everyone, and welcome back to the Wellness Zone podcast. I'm Mary Perry, and I'm here with Dr. Barry Sears. And each week we dive into the science of wellness, metabolism, and the dietary pathways to maintain them. This week we're talking about Alzheimer's. So, Dr. Sears, Alzheimer's is not just a concern of the aging, but it's also a concern for those that are having to take care of loved ones. And also, when we sometimes have those lapses in memory, we sometimes wonder if we're on that same path. So, why are we seeing Alzheimer's increase, would you say?
Well, there are many potential reasons, but I believe the primary reason we're seeing a dramatic increase in insulin resistance throughout our population. Now, I say, what has to do with Alzheimer's? Well, insulin resistance is often also associated with diabetes and obesity, and that's why they call Alzheimer's diabetes type 3. Because basically, besides the adipose tissue expanding when you have insulin resistance, or having the pancreas not working very well when you have insulin resistance, the brain doesn't work very well. Mm-hmm. And so this becomes an underlying cause and something we can do something about. But if we don't, all three aspects, diabetes, obesity, and Alzheimer's, will continue to increase well into the 22nd century.
So before we dive in a bit more to the topic of insulin resistance, where are we at in terms of the treatment for Alzheimer's? Where, in terms of drug trials and things of that nature?
Well, one simple way can summarize it. Pathetic. The fact is,
how do you really feel?
we have no drugs to treat Alzheimer's. The drug industry has spent pretty close to almost, maybe 20 or 30 $1 billion developing new drugs, and we have nothing to show for it. Now, is it because the people are stupid in the drug industry? No. But what if they're looking at the wrong target? They're looking at basically trying to close the barn after the horse has left. And that's why the drug treatments are using. We see these things in the brain, they're called tangles. And that's the problem. Saying, no, they're basically saying the horse has left the barn. You had the chance to get those many years earlier. Alzheimer's does not happen overnight. It takes decades for it to develop. And that's why we're seeing people saying, gee, I'm maybe in my 40s or 30s and my memory is just not as sharp as it used to be. That's something what used to happen to grandma. It's happening sooner because, again, obesity is increasing and diabetes is increasing, and that means Alzheimer's is increasing.
So, Dr. Sears, with the drugs that treat diabetes, they're not the same types of drugs that can be used for Alzheimer's. But if you can control the blood sugar in your 30s and 40s and 50s, you can help sort of prevent Alzheimer's from happening, or at least slow the progression.
Well, let's dive a little deeper. What's the underlying cause of all three of those, obesity, diabetes, and Alzheimer's? Basically, a disrupted metabolism. Now, if people have been viewers of our podcast, what's the cause of a disrupted metabolism? Inhibition of AMPK. So, perhaps if we basically had an orchestrated format to increase the levels of AMPK in every organ, including the brain and the body, we would basically see a resolution of obesity, diabetes, and Alzheimer's. But that means you're doing this years, if not decades, before the first signs begin to appear. Obesity is easy. You say, "Whoa, something's wrong. I'm looking at the mirror." But the brain, it's more subtle. But the mechanisms are exactly the same, and therefore I believe the treatment and prevention is exactly the same. So how do you basically know if you're activating AMPK? Insulin resistance goes down. Mm-hmm. And so now I have a marker. I have a marker of how long my brain's going to last. The lower my insulin resistance and the lower I can keep it for the most of my life, my brain will be working at peak efficiency.
So, Dr. Sears, I know we have listeners that join us every week, but why, just to kind of recap, why is activating AMPK so important in preventing it outside of, obviously the insulin piece? But can you kind of talk about the pathways of how it works?
Well, there are three major pathways. One, contrary to my keto friends, the brain needs carbohydrates to work most efficiently.
Hmm.
And so, therefore, if you basically aren't getting carbohydrates to the brain and into the neurons, they'll be suffering basically an energy deficiency. And that energy deficiency is the first step toward basically the inability to repair damage. Second thing about that is we have to basically improve the production of ATP. That's the currency that every organ in our body, especially our brain, runs on, especially the brain, because it accounts for 2% of the weight of the body, yet it consumes 20% of the ATP produced by the body. Why? To keep those nerves going back and forth so you can basically live a life. So as ATP or AMPK is decreased, the cell's ability to make ATP is also decreased. There's another aspect. They talk about the tangles in the brain cells. Well, what are the tangles? They're basically aggregated protein. Remember the old TV commercials back in, well, before your time, back in the 80s. I'd say, this is your brain on drugs. They put a couple eggs on the skillet.
Yes, I remember those.
And they all coagulate. Well, that's exactly what's happening in the brain. You're basically, proteins are aggregating. And the reason, there's a process called autophagy. Autophagy is how basically the cells in our body take out the garbage. And that is controlled by AMPK. So if AMPK is inhibited, guess what? The garbage piles up.
Mm-hmm.
And that's why you basically see these tangles, because again, the garbage collector isn't doing their job. So whether it be basically getting glucose into the brain to make ATP, or to make the mitochondria in the neurons to be more effective in making ATP, or taking out the garbage, basically the key is increasing AMPK activity in the brain. And if you can, then it's quite likely that Alzheimer's is basically a minor disease as opposed to a major fear for most people getting older in America.
So the next question, of course, is how do we raise AMPK levels in the brain?
I thought you'd never ask. The answer is metabolic engineering. And say what? What is that? Say, read my lips, metabolic engineering. It's going into the brain, in fact, going into every organ in your body, and reprogramming the metabolism. And the master switch of your metabolism is AMPK. So what you want to develop, if you're fearful of Alzheimer's, as well as diabetes or getting fat, then what you want to do is say, I want to take a strategy today that I can practice for a lifetime to basically keep AMPK activated. And in doing so, I can basically see the reduction of insulin resistance. So what is that strategy? Is there a magic pill? No. Can I inject the Wegovy in the body and say, no, that's not going to work either. But what will work is a unified dietary system where basically you're using three separate components, dietary components, each one working on a different mechanism to activate AMPK. So the first thing, you got to basically stop hunger. That's why calorie restriction is the most powerful tool we have to treat virtually every disease state, because that activates AMPK. You also now need adequate levels of omega-3 fatty acids. Americans are woefully low in that in their diet. So you have to have adequate levels because that also activates AMPK. And the final thing, called polyphenols. These are the chemicals that give fruits and vegetables their color. But they also are indirect activators of AMPK. So using those three components together in a system at the right time, at the right place, you now basically have a mechanism to reduce or increase the levels of AMPK. And how do you know it's working? Well, the blood will tell you. If your levels of insulin resistance are going down, basically then every organ, including your brain, is becoming more well. And that's really the definition of wellness, is basically reducing the levels of insulin resistance.
And Dr. just to bounce on that a little bit more, which markers can people look at to really tell if their insulin resistance levels are going down or in the right direction?
Well, the kind of standby has always been the HOMA-IR, but it requires doing a blood test for insulin, and the laboratories still aren't all that good at it. However, there's another test, a ratio of triglycerides to HDL cholesterol. That you get every time you get your annual physical. And ideally, that ratio should be less than 1. So if you can maintain that ratio of triglycerides to HDL cholesterol less than 1, that's a pretty good indicator that insulin resistance is not in any cell, any organ in your body, and your likelihood of developing Alzheimer's has now been dramatically reduced. Now, that being said, that's a lifelong effort.
Mm-hmm.
So you say, I'm going to do a diet to lose weight. Great. But what happens when you basically lose the weight? I'll go back to what I was eating. Not a good idea. So if now, let's take it, ratchet up. I want a diet to basically prevent me from getting Alzheimer's. It's exactly the same one to lose weight, but you have to practice it for a lifetime. And that's why the original definition of diet came from the Greek root, which means way of life. Mm-hmm. And so when we talk about metabolic engineering, we're talking about a way of life to basically reprogram your metabolism in each of your 30 trillion cells, including those cells that constitute the brain.